Hi, I'm Dr. Cath Watson, and today PD Insurance has asked me to talk to you about parvovirus in dogs. This is a highly infectious disease caused by a virus, and it's much more common in the wetter months, so spring and autumn, when there's more water lying around. Because this virus has an incredible ability to survive in the environment, it's also really hard to kill even with normal disinfectants. But the good news is, this is a virus that is easily preventable. We have an excellent vaccine which works really well in almost all dogs to prevent disease. Some breeds are more susceptible to parvovirus than others, and in particular we talk about black and tans, so that's dogs like your Dobermans, Rottweilers and so on. Parvovirus can affect any age of dog, but it's particularly severe in young dogs whose immune systems are immature, and obviously those that haven't had any vaccines. So dogs will normally pick it up by coming in contact with something contaminated in the environment, and that may be another sick dog. It may actually just be an area where another sick dog has been, and maybe in the mud, maybe on some plant material, maybe some saliva that's been left behind on a stick or something like that. The symptoms normally take about 5 to 7 days to appear, but it can be quicker than that. So that's 5 to 7 days after they've actually come across the virus and it's managed to get into their system. The symptoms you expect to see are actually relatively non-specific. Often to start with they'll just be a bit lethargic, then they'll go off their food, which is what we term anorexia, which means not eating. Then normally they'll develop vomiting and diarrhea, and the diarrhea, people will tell you it's classic, that it's a horrendously smelly bloody diarrhea, which it absolutely is. It's not the only cause of bloody diarrhea, unfortunately. Parvovirus, the virus itself, is very effective at damaging the gut, and it also suppresses the immune system. And because of the damage to the gut, it means it's very hard for the dog to get the nutrients in. It also gets increasingly hard for them to keep even basic stuff like water down. So they dehydrate really, really quickly. Because the immune system is suppressed as well, and the gut lining is damaged, it's really easy for infections to get in, so sepsis sets in. So sepsis being bacterial infections, and these can really, really quickly kill dogs that are affected. There is no specific treatment for parvovirus. It is all about symptomatic treatment, so trying to keep them rehydrated, trying to prevent or manage infections, and trying to get nutrition in any way we can, and supporting the immune system. Like I said before, it's easily preventable. We shouldn't really be talking about how to treat them, because if your dog is vaccinated, the chances of them picking up parvovirus is very, very low. Because it's so highly infectious and treatment is symptomatic, when we're treating these dogs they also have to be isolated, so not only are they dealing with a pretty nasty illness that certainly has the potential to kill, and certainly the chances of death increase in young dogs, but that isolation also means that these young dogs are having to stay away from their normal social interactions at a period of their life where those are really, really important. So parvovirus, highly infectious, highly contagious, really nasty viral disease that not only can make dogs really, really sick, it also sets them up for all sorts of problems later in life. Not only potential physical health problems, but also behavioural problems. So please, please, please go and get your dog vaccinated. It is so easy to prevent.